And then they kind of slowly slide you into the MRI, and then you realize, you know what, I got this much space from my face. And I looked a little bit to the side, and I saw I had about this much space from my shoulder. And then, you feel a little bit claustrophobic. Vigorous Steve here. Let's go over all of the heart examinations which I performed over the last couple of years. We'll discuss ultrasounds, MRIs, chest x-rays, 48-hour Holter monitors. I've done it all over the last couple of years, and I want to give you guys a little bit of an insight into the functioning of my heart, and perhaps present some anecdotal evidence of a functioning of the heart after a decade of steroid use and performance-enhancing drug use, with the occasional period of PED abuse, right? I've made some mistakes in the past, done some pretty heavy cycles, whether that's anabolic, androgenic steroids, or peptides, or everything in between, right? I made some mistakes, so I'm going to disclose everything in this video so you guys have a little bit of an insight into what has been going on and why I've been so extensive regarding the MRIs and the ultrasounds as of late. Now, first, I want to discuss some results from February 2015, when the first time I was experiencing some heart issues. At that time, I was on cycle. It was an off-season cycle, I believe. I can't really remember what the cycle was. Maybe a gram of test and a gram of boldenone, or somewhere along those lines. And eating a decent amount of food, trying to increase my calories in order to gain size. Getting stronger, right? Eating more food and, right, getting bigger overall, increasing my body weight. Now, somewhere along that off season, I started experiencing arrhythmias. So I'll describe it to you guys. I would sit at my desk, just working normally on clients' programs, and then my heart would stop. And in the 1 or 2 seconds before it would pick back up, I would check my pulse here, my neck, because it's a little bit easier to grab than the wrist. So I checked my pulse, and I could literally feel my heart physically sink, basically. That's how it felt. I would check my pulse, almost have a mini anxiety, a panic attack, because I thought I was having a heart attack, right? And my heart would stop, and I was like, is this defibrillation? What's going on? Am I having a heart attack at the moment? And then my heart rate would pick back up at an accelerated rate, and then slowly come back down to a normal resting heart rate. First time this happened, I freaked the F out. Yeah, it was very scary. I had no idea what to do in those 2 seconds where I didn't feel my heart rate when checking my pulse and my neck and then picking back up. Very scary, right? Probably the worst 2 seconds of my life, besides breaking my leg in a motorcycle accident and, well, a couple other things that I'd like to keep private, but very scary nonetheless. So my heart rate would pick back up, and I would sit there. You know, well, what's going on? I had no idea. Okay. A couple days went by, nothing happened. I would go about my business, go train, right? Do my usual workouts, balls to the wall, and as insane as possible for the sake of hypertrophy, right? Rest pause sets, Widowmaker sets, right? Really increase the intensity. And then this stuff would happen again when I was sitting at home. My heart rate would stop. I feel physically my heart sink. Check my pulse, have a micro panic attack, and then my pulse would pick back up. Now, that was my second experience, and then it started happening more frequently. To the point, it got so bad it happened 10 times per day, maybe even 15 times per day. So at that point, I realized, you know what, I tried a couple things. I did my research online. I had to go through all these studies regarding arrhythmias or heart stopping in the context of animal studies or athlete studies. I tried a couple different supplements for heart health. I really looked into my electrolyte intake. I took 2 weeks off from the gym, reduced my food intake, tried to get my body weight down in an attempt to resolve it. And it would just continue, right? I maybe have less over the course of the day. Maybe it happened only once, and then the next day would happen 5 times, and then it didn't happen for 1 day, and then 10 times again, right? So after a while, I was like, you know what? I got to get some examination done. So went to the hospital, made an appointment with a cardiologist, which were specialized in athletes. Fortunately, this cardiologist has moved on to the States. So, right, a very knowledgeable guy. I can't remember his name, but a very knowledgeable guy. Was very, very helpful during this period that I was freaking out a little bit about what was going on. So we did an ultrasound on my heart. That was the first ultrasound that I did. And we scheduled a 48-hour Holter monitor. This is where they attach electrodes all over your chest to observe how your heart is functioning over the course of 48 hours, right? 2 days. So we did an electrocardiogram there on the spot in the hospital. And then the doctor said, okay, the electrocardiogram just shows that you have a sinus bradycardia, which means a low heart rate, which is to be expected when you train frequently, right? It's a low resting heart rate is normal for, well, I wouldn't say athlete, but right, physically active. So he recommended, okay, we're going to do an ultrasound and a 48-hour Holter monitor. During those 2 days, you're going to train your maximum workouts, right? So I did a leg day and I did a back day. So we can assess what exactly is going on when your heart rate stops and then picks back up, when you're sleeping, when you're sitting at your desk, and when you're training, right? He wanted to get all of the data with the ultrasound and an electrocardiogram at the hospital and just make an accurate assessment. Now, unfortunately, I don't have the results of the ultrasound which was performed on my heart. I've been in touch with the hospital to get those results over the last couple of months, but I don't think they have those results anymore. Again, it's from February 2015, so I don't expect them to keep all of those results. I did have a little bit of a diagnosis on paper, but I've seemed to misplace those. What I do have is the results from this whole booklet. I have the results from the 48-hour Holter, so I'll scan this and then overlay that on the screen when we're going to go into the results of the 48-hour Holter monitor. Now, regarding the ultrasound, basically what the cardiologist told me at that time is that I had slight heart enlargement. The valves were working normally. I had normal ejection fraction. There was no left ventricular hypertrophy or not hypertrophy of the middle of the heart. There's a little muscle in between the left and the right chamber of the heart, which can also hypertrophy and enlarge, causing the valves to close improperly. So after the diagnosis with the ultrasound and the electrocardiogram, he said, okay, your heart is a little bit enlarged. You don't have athlete's heart just quite yet. There's no thickening of the heart muscles, right? Not of the chamber, not the little muscle in between. So your heart is basically normal, right? You have normal heart functioning and it's a little bit enlarged, which is to be expected when you train intensely. I had no cardiac event while we were doing the ultrasound. Also, no real cardiac event while we were doing the electrocardiogram. So he sent me on my way with a 48-hour Holter monitor just to see what was going on, right, at these points where my heart rate would stop and pick back up. So I have the results here. We'll discuss that a little bit and I'll overlay it for you guys on the screen. It's very interesting. I have a minimum heart rate, which occurred during the night, of 34 beats per minute. Only 34 beats per minute. It's a very low heart rate, which occurred for me at night. An average heart rate of 69 beats per minute and a maximum heart rate of 167 beats per minute, which happened on the second day when I was training legs. So the doctor analyzed the 48-hour Holter monitor results 2 days later after I gave him the 48-hour Holter monitor back with all the results which were recorded within. He gave me the following interpretation of what was going on. I had, at the time, sinus rhythm and sinus arrhythmia with an average heart rate of 69 beats per minute and rare premature atrial contractions with rare isolated premature ventricular contractions. A mouthful, hard to pronounce, but it basically means the following. You have your atrium, it's the top of the heart, which also heart chambers, and that would prematurely contract, throwing the heart rhythm, the normal heart rhythm, out of sync, out of balance. So you get into a heart arrhythmia. So you either get an extra heartbeat in the in the atrium or the ventricular space of the heart, or a skipped beat where it would not contract at the right time for your heart to have a normal rhythm, sending you into an arrhythmia. So basically, normal functioning of the heart is like this. Well, I have a ton of videos regarding the recent ultrasounds and MRIs, which I'll show a little bit later in this video. So normally it would contract at a certain rhythm. And then what would happen in 2015, one part would contract and then the rhythm would be off and my heart would stop and then pick back up, right? When the electrical signals would be sent surrounding the heart in the normal pace again. Very uncomfortable experience, to be honest, really. And the rest of the interpretation of the doctor, patients has symptoms of correlated with sinus arrhythmia. So what I was experiencing was what they was able to diagnose, the sinus arrhythmia. There's no significant pause of the heart and no atrial fibrillation. What was happening, what the cardiologist explained to me, is my heart would stop and this premature atrial or ventricular contraction would be a result of training intensely. And a similar thing would happen when I was training. The heart would stop because the blood pressure was too high or the heart rate was too high, or I simply put too much strain on my body, right? With the crazy wrist spot sets, training to failure or beyond failure, drop sets, right? I was training pretty hard. So what the doctor explained to me, he said, listen, if you train this hard, and he showed it to me on the graph, my heart would stop, right, during the time of a strenuous set and then pick back up. But I wouldn't notice it because I was training, right? I would be focusing on the set. And then as I put the weight down, basically within half a second, the heart rate would pick back up and then at an accelerated rate to oxygenate, right, the tissue and take the metabolic waste products away, the lactic acid, the carbon dioxide, and all that stuff. It started happening during the day as well, but I would not be training, simply going into a premature atrial or ventricular contraction, which would also happen during the workout. So we came to the following conclusion: I should not be training so hard. During that time, I really focused on my taurine intake, 5,000 milligrams per day. I started taking more ubiquinol. I was already running a maintenance dose of 100 milligrams ubiquinol twice per day. But I believe around that time, I started experimenting with taking ubiquinol pre-workout. And, well, after I added in the Shilajit fulvic acid, after one of the loyal subscribers or followers sent me a study that Shilajit fulvic acid was able to have a positive effect on heart remodeling in the case of heart enlargement. I can't remember if that study was performed on athletes or normal people, but I believe the combination of ubiquinol and Shilajit fulvic acid had a positive effect on the functioning of the heart and positive heart remodeling. So I've been running 5,000 milligrams of taurine, well, let's say between 200 milligrams ubiquinol and sometimes even 600 milligrams ubiquinol per day, plus 250 milligrams of Shilajit fulvic acid whenever I would take a serving of ubiquinol, because Shilajit fulvic acid promotes the absorption of ubiquinol. I mentioned this a little bit more in detail in a previous video about unconventional pre-workout. Unconventional pre-workouts. So give that video a watch. So with that supplementation protocol, making sure that my electrolyte intake was always good, right? The proper magnesium, calcium, potassium, and sodium and phosphorus balance. I was able to resolve this issue. And to be honest, when I think about it, over the last 8 months, I don't think I've experienced any of these premature atrial or ventricular contractions because my training intensity hasn't been that high. And I've still stayed on top of my health supplements, right? So maybe now for a reduced training intensity that I have because I went off cycle, and recovery capability is not as good as it used to be on cycle, and definitely not as good as when I was 32 years old. And I don't take as many sets to failure, right? I learned the hard way. So my health supplementation hasn't changed. So I still take 5,000 milligrams of taurine, and I still take 200 to 400 to 600 milligrams of ubiquinol, and 250 milligrams of Shilajit fulvic acid per serving. So that's up to 750 milligrams Shilajit fulvic acid per day, plus 5 milligrams of nebivolol and 20 milligrams of telmisartan, right? So they all have a positive effect on heart functioning, keep your heart rate down, keep the blood pressure down, and provide energy and correct electrolyte balance for the heart to function properly. So I haven't really had this issue for the last couple of years. Maybe the occasional skipped beat, but certainly not as prevalent as it used to happen. Now, I've talked to a lot of bodybuilders during consultations here in the gym, which had similar issues, which they were also able to resolve by going on a beta blocker and an ARB like telmisartan, for example, and using 5,000 milligrams of taurine, ubiquinol, and Shilajit fulvic acid, and paying attention to their electrolyte balance. So I know it sounds very scary. It was very scary for me, but I was able to resolve it for myself and a decent amount of people that I talked to which experienced similar issues. Some of them went in for a 48-hour Holter monitor and get a comparable diagnosis with the premature atrial and ventricular contractions, or they had some sort of other arrhythmia going on, being diagnosed with sinus arrhythmia. So that combination was very beneficial for myself. So that was my first stint of hospital visits regarding the functioning of my heart. Let's fast forward a little bit to September 2020. First, I went in for a regular cancer marker screening, which I usually do every year, or at least when I'm using growth hormone. Just want to make sure that none of the cancer markers are off. But in September 2020, my neuron-specific annulase was slightly elevated. Now, I couldn't really make sense of it because some of those studies which were performed recently showed that neuron-specific annulase can also be elevated due to the global disease that is going on right now. So right after a half a day of research, I booked an appointment with a cancer specialist at the same hospital that did the ultrasound and the 48-hour Holter monitors just to get diagnosed again, see what was going on. Now, they did a slew of tests. They did a chest x-ray. They did an ultrasound of my entire abdomen. They rechecked the neuron-specific annulase, a couple other cancer markers like H. pylori as well, right? Just to make sure that I was cancer-free and that all my organs were healthy. Now, most of my organs were healthy, but I was diagnosed with non-alcoholic fatty liver disease because the echosonicity of the liver ultrasound was quite blurry, indicating a decent amount of fat stored within the liver. And of course, my liver enzymes were quite elevated for a prolonged period of time. So I was diagnosed with non-alcoholic fatty liver disease at the time, leading me into going for post-cycle therapy, coming off cycle, doing all these things to resolve that issue, which is now resolved, but we'll discuss that in a separate video. Otherwise, this video will be 2 hours. So this video is just about heart health. They did a chest x-ray. And then they diagnosed or they saw something regarding my aorta, which runs from the heart up. So I'll overlay the chest x-ray report and read out the results. Chest PA upright with additional lordic view. So that's describing how the x-ray was performed. You have to hug the x-ray plate. And I guess that's the way they write that in the report. Heart is normal in size. So I was happy to hear that because, again, the last examinations which I did in 2015 previous to this examination showed that I had a little bit of heart enlargement during the ultrasound. So I was happy to see that at least on the x-ray, my heart was normal in size. Displacement of lower trachea to the left is noted with extraluminal pressure effect, suggestive of right side aortic arch. The DDX is hidden right superior medial steinal lesion. Please close follow-up. So what this means is that the aorta, the main artery which comes from the heart and then branches off and supplies blood to the rest of the body, it comes up to the right and then branches off into another artery which then pushes my trachea to the left, which in some cases might obstruct breathing or swallowing. So I've never had an issue. I had asthma when I was younger, right, which is an issue of the lungs. But I never, ever had issues breathing. Not when I was climbing mountains at 3-4 kilometers elevation. Not when I was swimming intensely. Of course, I would have issues when I was being asthmatic in my younger years. But I would use Ventolin, salbutamol inhalers for that. And I never had an issue breathing during a workout either. So it's purely congenital. That artery that's been pushing my trachea to the left has been there since birth. Now, in this x-ray, they told me to do a follow-up. Again, a chest x-ray is not the best way to diagnose a heart and heart functioning. But based on what they saw regarding the aortic arch, they said, okay, you should be doing additional screening in the future, but right now it's not immediately necessary. So I predominantly focused on my post-cycle therapy and resolving the non-alcoholic fatty liver disease and trying to maintain whatever gain I had previously, even though I did lose, 25 kilos in the process of resolving the non-alcoholic fatty liver disease. So let's go over the echo summary and the reports. They mention ECG in this hospital, which stands for echocardiogram, which is different than electrocardiogram. With an electrocardiogram, you lay on a table and they put the electrode similar to a 48-hour Holter monitor just to see what your heart rate is at, see if there's any weird arrhythmias going on. I usually get diagnosed with a sinus brachycardia, which means a low heart rate, which is, I believe, below 60 beats per minute. And usually when I lay on the table, I kind of relax, because you're at the hospital. And there's always a reason why you're at the hospital. So I tend to relax, and that lowers my heart rate a little bit more. Now, in the context of this ultrasound or echocardiogram, the ECG stands for something else compared to an electrocardiogram. So same abbreviation, different measuring devices. The summary reads as follows. Echocardiogram was sinus brachycardia 44 beats per minute. Again, low heart rate below 60 beats per minute. That's what sinus brachycardia means. You also have sinus tachycardia, which is above 150 beats per minute, 130 beats per minute. Which again, in the 48-hour Holter monitor, I had sinus tachycardia because I was going to the gym at that time. Left ventricular ejection fraction, 74%, and wall motion is normal. Now, normal left ventricular ejection fraction is between 55 to 70%. An ultrasound is not the most accurate way to detect the ejection fraction. And you'll see with the MRI that there's a little bit of a discrepancy between the results of the ejection fraction on the ultrasound, the echo, and the MRI, which is a little bit lower, and that falls within normal parameters as well. So when I saw this, it was like, okay, I have awesome ejection fraction, even higher than normal. But when you do a little bit of research, you see that there's also issues related to an ejection fraction that is higher than 75%. I believe that it has to do with thickening of the walls or an issue with the valves. Again, I could be mistaken, guys. I'm just reading what's on the paper. I'm not a heart specialist, and whatever I talk about the heart in this video, a large portion of that is regurgitation, which we'll get into heart functioning as well. Regurgitation of what the cardiologists have been telling me over the last couple of years. There is no left ventricular dilation or hypertrophy. 10 years of steroid use, no hypertrophy of the left ventricle. Now, did I abuse nandrolone? No. Did I abuse cabergoline or any other dopamine receptor agonist? No. I did train as hard as I could, right, for the sake of bodybuilding. The left ventricular diastolic function was normal. Left atrium is not dilated, but the left atrium volume index is 33, which is not considered to be normal. That's below 19 milliliters, I believe. So that's the volume of the atrium itself, the left atrium. And in my case, I fall into the mild to moderate volume index between 29 to 33, 34, depending on the reference range. So my left atrium is a little bit enlarged, but apparently that's normal for people who are very physically active, or at least that's what the cardiologist told me. I basically said, well, it's a little bit enlarged. Could it be contributing to these arrhythmias that you used to experience in the past? Potentially. But it's actually quite common with people who have or are very physically active, especially in strength sports or strenuous workouts. So that's one of the things that it's a little bit off in this result. There's a trivial, mitral regurgitation, trivial tricuspid regurgitation. I'm sure I'm butchering all these medical terms. And mild pulmonary regurgitation. Apparently that all falls within normal parameters. This is the regurgitation between the valves. I'll show you some of the footage from the ultrasound later because, of course, I got the footage for YouTube. Right? YouTube, or did it happen? So there's a little bit of regurgitation between the valves of the different heart chambers. The mitral and tricuspid has trivial regurgitation and the pulmonary valve has mild regurgitation. Apparently that all falls within normal parameters. And then there's something about the pressure, which I have no idea how to read. So it's on the screen. You guys do what you want with it. Systolic function is normal. There's no intracardiac shunt. The aorta is not dilated, and there's no pericardial effusion. So after getting these results and talking with the cardiologist, she said, there's absolutely no need for you to do an MRI, Steve. Really? Why are you wasting your money on an MRI? Everything looks normal. You were able to resolve this issue that you had in the past with your supplementation protocol, based on your blood work and how diligent you've been with your inflammatory markers and your cholesterol lipid levels. I highly doubt that there's any calcium present, so we don't need to do a calcium score, right? You determine that with a CT scan. So the CT scan was basically not needed, but I just wanted to do an MRI for the imaging, just for my own well-being and state of mind. Because again, an ultrasound is not the best way to diagnose heart functioning. And right, I felt, you know what, after 10 years of steroid use with the occasional period of abuse, I just want to have the data. I just want to have the data. So based on this ultrasound, no hypertrophy, no left ventricular enlargement, and basically normal high ejection fraction. The only thing that was not normal was the left atrium, the size of the left atrium, with a volume index of 33 and trivial and mild regurgitation on the valves. Let's have a look at those ultrasound results, which I did get for you guys. Again, I have no real knowledge or medical background to interpret these results. Normally that's done by the cardiologist or the sonographer. I just wanted to show it and overlay it with you guys in case you haven't done an echocardiogram or ultrasound yourself on your heart. So you can have a look at this footage to see how interesting this looks. Because again, medical imaging allows you to have a look inside without getting invasive, right? Without making incisions and then, then it turns into a gory movie. This is basically a non-invasive way to image your heart or other organs. So here you can see the opening and the closing of the valves. Very interesting to look at. And here, this is a little bit of a close-up. I'll guide you through a little bit of the process, how this ultrasound is performed. So you lay down on the bed first. You start on your left side. Then they start doing ultrasounds on the upper quadrant of your chest. Of course, they use an ultrasound device with a little bit of this jelly to make sure the sound waves transfer in and out of the device properly. And then they slowly start repositioning the ultrasound at specific locations, allowing them to see and observe what's going on internally. So they'll lay you on your side for a while, take a couple readings, and then lay you on your back, take a couple more readings. And I ended up getting about 70 measurements. And then they go to work on the results and they'll let you know what's going on. But we already discussed that a little bit previously. So let's just go over this footage, which is always cool to see. I think this is the closing and the opening of the valves in between the different heart chambers. So that's probably a diagonal observation with the ultrasound device. And this is probably a little bit lower. Again, I'm just speculating because I can't remember which of this footage was taken with a specific point of measurement. I'm just going by what I've learned about human anatomy. I don't know if I'm completely off. Let me know down below in the comment section. So we can all laugh at my lack of medical interpretation. So this is another angle of the heart. Let's see. This one is, I don't even know which valve this is. It looks like a mouth opening and closing. Right, this could be the Sarlacc pit in Star Wars. This is not Boba Fett approved. I think this is a diagonal view between the left and the right chamber of the heart. And here you can see the flow of the blood between the different heart chambers, which is very interesting to see. So you see my valve is opening and closing. And based on the blue, they determine if there's a little bit of regurgitation. Now, I'm not exactly sure which valve this is, whether that's the mitral, the tricuspid, or the pulmonary valve, but based on the little bit of activity that you see when the valve is closing, that's how they determine if there's any trivial, mild, or moderate, severe regurgitation. It's the same with this footage. You see that it's still a little bit of blood flow and activity when the valves are closing. It's so interesting to watch this stuff. Normally you see yourself only from the outside, and this allows you to look internally. It's fascinating to me. It's certainly a lot. I wouldn't say pleasant, but not as unpleasant as a colonoscopy. And let's close off this video with the cardiac MRI results, which were performed on the same day as the cardiac echocardiogram or cardiac ultrasound, with about 2-3 hours in between. It took them a little bit longer to analyze and report this data, almost 2 weeks. But as soon as I got the results, I started my 4th cycle a couple days ago. So let's analyze the results here together. The examination was a stress perfusion study using adenosine as a vasodilator, which is administered somewhere halfway through the examination within the MRI. And then within a very short time frame, they administered the adenosine and a contrast dye in the form of gadolinium, I believe. Gadolinium, if I pronounced it correctly. So they administer the adenosine intravenously. Then it acts as a vasodilator. You start to hyperventilate. I should have been holding my breath, but we'll analyze the footage a little bit later. And I think I was still breathing at the time that the contrast dye and the adenosine was getting into effect. So it's supposed to be, you're supposed to hold your breath while that it's all occurring. But when they administered the adenosine intravenously, I started hyperventilating for about 2 minutes. I'm not unfamiliar with this feeling because I've taken intramuscular adenosine monophosphate, triphosphate injections for the sake of bodybuilding in a pre-workout setting, or to see if it can blow you up in a pre-contest setting, very commonly used for pre-contest on the day of the competition, where a decent amount of adenosine monophosphate or triphosphate is administered to act as a vasodilator to give you a ton of fullness. You can also use it pre-workout to give you a ton of energy. So I'm familiar with the adenosine effect, but not intravenously. And that's one hell of a roller coaster. I'll tell you that. And the MRI machine is so narrow. Did you guys ever go to a water park where you have that chute that goes basically straight down? You have to hold yourself like this. You're in this very narrow tunnel with water. That's basically what it feels like. And then the adenosine is administered. And in a moment that they're basically counting down that the floor is dropped in this water slide, you get a rush of this water slide effect. And that's basically the closest analogy I can make laying in the MRI when they're administering adenosine to the point you start hyperventilating. So it was a non-breath hold MRA coronary examination, viability study, and a function study. Now, before we get into the rest of the results, let me guide you through the process of doing an MRI. They sit you down in a separate room, and then they put IV into you. They wanted to do here in the wrist, but I fasted all day, which I didn't know was required or not. But usually when I go to the hospital, I fast. Just in case they want to do an examination in a fasted state. So I fasted, didn't have any sodium that day, so I was a little bit nervous at the hospital. So my veins in my hand, normally they put it here in the hand. There's a little vein here on the thumb. But all my, like now basically, all my veins were gone. So they put it in here with the IV vein, and then they extend that to the hand because you're laying in the MRI machine where they're administering the adenosine and the gadolinium contrast dye. So I had one here and one here. They couldn't bend my arms basically, but well, my veins were a little bit collapsed, so they had to take the veins within my inner elbow. So they put that there, and you walk to the MRI, and then you try to lay down without using your arms. And then they start putting all kinds of stuff on your chest. They put something around your waist. They put something on your chest. They give you a little bit of a blanket, which was actually not required because it was freaking hot in that machine. And then they kind of slowly slide you into the MRI, and then you realize, you know what, I got this much space from my face. And I looked a little bit to the side, and I saw I had about this much space from my shoulder. And then, you feel a little bit claustrophobic, especially considering that you're completely strapped in to the bed, right? With something around your waist, something on your chest. They have a little bit of a mattress, which over the duration that you're in the MRI, I was in there for 1 hour, 40 minutes. That mattress is not very soft, and my ass was getting a little bit numb at the end there. So once you're in the MRI, you get a headphone so they can give you instructions. I was assuming that the headphones had a little bit of a two-way communication, but that was not the case. There was no microphone within the headphones. So they gave me some instructions. I acknowledged verbally, but they couldn't hear me because they're in the other room operating the MRI machine. So I was laying there all by myself. There was no music for me, just instructions. And it's very, very repetitive. Breathe in, breathe out, and hold your breath. I must have done that 100 times. And every time you hold your breath, they take one measurement. So they did, I have 70 movies also, or 50, 60 videos of the imaging that occurred. And when you hold your breath, you hold it for about, I think a couple times was almost 40 seconds. Was quite long, but most of the time it's about 20 seconds. So I counted it, and then they do 10, 12 measurements. And then the MRI machine makes a ton of noise. It's really, really loud. And every time it makes a measurement, it makes a sound representative of a Michael Bay Transformers movie. And it does it like 10, 12 times per measurement. So you're holding your breath. You have all these Transformers around you fighting. And then you get about 30 seconds break to take a couple breaths. And then you have to hold your breath again. So it does get old fast. But again, for the sake of heart health and having fundamental insight into the functioning of your heart, it's just something you have to go through. And I'm happy that I did. The impressions are the negative adenosine stress magnetic resonance imaging for myocardial ischemia. No idea what that means, but it's a negative result that there's an issue regarding my heart when the adenosine was administered. No evidence of a myocardial infarction, so never had a heart attack, even though my creatine phosphokinase levels have been very, very high. Right? 1,000, 2,000, 5,000 units per liter. No evidence of a myocardial infarction ever. No chamber dilation, assuming that's the ventriculars. Normal left ventricular regional wall motion with systolic function. Left ventricular ejection fraction was 64.9%. So there's a little bit of a discrepancy between the ultrasound at 73.7, 74%. And the MRI at 64.9%, which is still towards the top end of a normal ejection fraction ranging from 55 to 70%. So, right, normal ejection fraction. Normal coronary anatomy, no significant stenosis of coronary arteries, and the incidental findings are right-sided aortic arch, with aberrant left subclavian artery forming partial vascular ring. Deviation of the trachea and esophagus to the left, causing 50% reduction in trachea diameter. 50% reduction, which I never noticed. So I talked with the cardiologist that analyzed these results for, quite long, maybe 30 minutes, 40 minutes on the phone when they called me. To give me the results. Again, I don't want to go to the hospital a couple times to talk again and wait, because going to the hospital always takes several hours out of my day. So I asked him to call me. So on the phone, he explained to me that it's probably congenital. It's been there since birth. And if I didn't experience any issues up until now, that I'm at the age of 37, almost 38, it's really none of the concerns. So I've never experienced an issue with breathing or swallowing food, but apparently there is something going on right here where the trachea and esophagus is being pushed to the left and restricted because of this artery. And the diagnosis is that this is a negative study, meaning that there's no results that I need to take immediate action on. So I'm very happy with those results. I literally did a couple circles like Homer Simpson on the floor when I got that phone call. Again, because I always had it in the back of my head, these issues that I had in 2015, right? These arrhythmias that I was experiencing, and this X-ray, which said something about an aortic arch, which I did a lot of research on, and wasn't really sure about what was going on, right? So that's why I wanted to do this MRI. So after a lengthy discussion with the cardiologist, he said my heart is perfectly healthy. There's no left ventricular hypertrophy diagnosed with the ultrasound and the MRI. There's no heart enlargement. I might speculate that my heart is a little bit smaller now compared to the tests which I did in 2015. Again, I wish I had those results to make a direct comparison. But I can't, right? So I'm just going by what I was told. And now I'm told that there's no sign of real heart enlargement besides this atrium, which is a little bit bigger volume than with normal people. Now, let's get into the footage because the footage is really, really cool, to be honest. So we'll start with this cross-sectional imaging of my torso, where you can see the heart, the lungs, my spine, my chest muscles, and all that stuff. It's really cool to see. So when you do an X-ray, it's from the front, right? They don't do a cross. But in the MRI machine, they do a cross study. So I had to hold my breath, I think, it felt like a minute, but probably 30, 40 seconds. And at which point they took this cross-examination of my chest and, my upper torso to see how my heart is, like an initial examination to see how they need to position the machine. I see two lines, right? You see on the left side, you see a cross line and a straight line. I'm not sure why that is. It could be that's from, right, the plate that they put on my chest. Again, I'm just speculating. I haven't really had a chance to talk with the cardiologist or the operator of the MRI machine. When I get those results, I only had that phone call. So still, very interesting to see. So this is the actual MRI imaging, where every time you have to hold your breath for them to take pictures of your heart and the arteries and everything that's going on internally. So I'll overlay the cross sections with about 5-second intervals because it's only 25 frames. So I'll play that on repeat for about 3 rotations and then work our way down. So they take some measurements here, move down a little bit here, then here, then here, and here. And then when we get to the heart, I'll pause it a little bit so you guys can actually see how the heart is contracting and get a cross-diagonal view of the heart chambers, the valves, and all the arteries, which are then branching to the lungs and to the lower body, upper body, and everywhere else. So it's very cool to see. This is, as you can see, it's much more detailed compared to the echocardiogram, the ultrasound. And of course, the examination takes way longer and is a lot more cumbersome than the ultrasound as well. But again, this is one of the most accurate and most detailed ways to get imaging done on your heart. I have no idea what a CT scan result looks like, but maybe 3-4 years from now, that will be my next examination. I'll do a CT scan and then post it on YouTube, just like these results. Now here you can see a really proper functioning of the heart with the chambers of the heart opening and closing. Again, it's a cross-diagonal examination, so you get like a top view, basically. And it's so cool to see, really. It's far more detailed than the ultrasound. You can also see how the blood is moving in and out, right? It's a little bit darker and brighter in particular areas depending on how the blood is flowing and how you see the heart is beating. Yeah, it's really cool to see. I'm also consciously aware of the amount of chest fat that I have. Again, I hold a little bit of fat in my chest and apparently also armpits. which I will be taking care of on this next cutting phase. Now, this is very clear to see how the heart is functioning with the valves opening and closing. And in the time that I was in the MRI, I did not experience any of the arrhythmias which I experienced previously. Again, I haven't been training that hard up until this point, but I have been training a little bit harder as of getting the results. Now, we're working our way down. Here you see the bottom of the heart contracting and moving the blood around. And then as we'll move more and more down, I'll start to shorten the imaging again because there's less to see, and I'm sure you guys get the idea of how my heart is beating and functioning with these MRI results. As the bottom of the heart, you can see the lungs a little bit better, the spine, the bottom of my chest. I think at one point you can see my nipples on these results, right? There's a little bit of discrepancy between the chest fat and the nipple. Maybe that's even gynecomastia that we're seeing. And again, at one point I'll have to address that gynecomastia tissue with surgery if the raloxifene treatment is not successful. Very cool to see. Let's move on to another angle. This is, I'm assuming, right? I'm speculating that this is done at a 45-degree angle like this to get a little bit of a different image of the heart, especially the left ventricular heart chamber. Now, again, my anatomy could be completely off. I'm just going by what I see, and I didn't have an opportunity to talk with the cardiologist regarding these specific videos and images. So here we can see that the heart is beating from a different angle, but it's still very interesting to see how that is functioning and how my heart is beating in the time that I was in the MRI. And I think this is a vertical measurement. I only have 2 measurements of this footage, so I'll extend the footage a little bit so you guys can see how the different chambers and the valves are opening and closing and how my heart is beating. And I think that's my stomach and my colon down below and the lungs up above and surrounding the heart. Very cool to see how the blood is flowing from the heart to other organs, whether that's the lungs or the blood is flowing in between the different heart chambers. Again, the insight that you get into the functioning of your heart with an MRI is far above and beyond what you get with an ultrasound. And I think this is the only measurement where I didn't hold my breath. They instructed me twice to breathe in, breathe out, and then breathe in again. And I think this is the measurement where I was holding my breath. So you can see that my lungs are a lot more expanded compared to the other measurements which I showed previously. And my heart is looks a little bit larger as well. It's mostly the lungs, but they wanted to assess how my heart was beating when I exhaled and how my heart was beating when I inhaled and held my breath. So it's a little bit different than the footage I showed previously. But again, we'll leave it up to the experts to diagnose how the blood is flowing, how the valves are closing, and if there's any regurgitation or issues or ejection fraction problems, which again, based on the reports, it's all A-OK. And then the last footage I have to share is from the adenosine and gadolinium administration, the contrast dye. Now, I think that it was hyperventilating at the time of these measurements, simply by how the footage looks. Again, I didn't have an opportunity to talk with the cardiologist regarding the specific footage that I'm showing, because he called me and basically gave me the good news that everything was functioning normally. And of course, based on the diagnosis paper that I got, they said it was a non-breath hold magnetic resonance imaging of the coronary artery with the adenosine administration. But it's still very cool to see. You see the contrast dye is going through all the different parts of my body as it's lighting up the MRI results. So every time you see a little pulse on the footage, that's the contrast dye. And I think the breathing, right, that's probably me hyperventilating because the adenosine is, that's something else. Very interesting to see based on what they saw here. They said that there's no issues with my arteries, right? The blood flow is normal. There's no obstruction within any of the arteries surrounding my heart. which would otherwise indicate maybe some sort of coronary artery disease, right? A little bit of a calcium, a plaque buildup. So based on what they saw here, the perfusion test, the adenosine results, and the contrast dye results, they felt there was absolutely no need to subject myself to a CT scan in the immediate future. Nothing to suspect that I would have any way, shape, or form of plaque buildup, and that my calcium score test would probably come back as 0 anyway. I will still do that test maybe when I'm at the age of 40, simply because 40 somehow magically puts you in this risk group. But for now, I'm kind of done with the examinations. Again, the MRI was good, the ultrasound was good, and the chest x-ray, which I performed a year ago, and the issues which I had regarding the sinus arrhythmias have mostly been resolved. So I think we'll leave it at that, guys. This video is probably already way too long. I hope you're still with me at the end. If you are still with me, let me know down below in the comment section. Thank you guys so much for watching. I really hope this was entertaining and informative and somehow helpful regarding your own performance-enhancing drug journey. Again, as of me, anecdotal evidence, no left ventricular hypertrophy, no heart enlargement. There's no indication of issues with the coronary arteries, right? No stenosis, no indication of obstruction, normal blood flow. Basically, it's all good. And honestly, the cardiologist was a little bit surprised when I discussed my history regarding anabolic steroid use and growth hormone use and insulin use and IGF-1 use and the use of beta-2 adrenergic receptor drugs like clenbuterol or ephedrine in the past. Right? I've dabbled and experimented quite a bit with the PEDs, and, well, no issues with my heart, besides a little bit larger sides of the left atrium, larger than normal, but apparently a non-issue. My heart is functioning normally for an athlete, and it appears to me that there's no negative effect of the performance-enhancing drugs that I took. And I'll leave it at that, guys. I hope you found it informative, entertaining. I hope you learned something from this video. If you're part of the Vigorous crew, much appreciated. I know you already commented. I know you already liked. If you're not part of the Vigorous crew yet, all you have to do is leave me a comment and leave me a like. And I'll reward you with a front double bicep with a little bit of test and primo contained within. Is it looking better? I don't think so, but it's only been 2 days. Let's give it a couple months. Much appreciated. Thank you guys so much for watching. See you guys in the next video where we'll discuss liver health and liver results of all the examinations which I took over the last couple of years. Hopefully it won't be as long as this one. See you guys then.